We never speak about being moderate in our water intake. Be moderate with your fruits and vegetables. I never hear that once. I hear be moderate in the cake. I'm very moderate in my alcohol consumption, but we never say that about anything that's truly health promoting. It's interesting.
This is the Visible Voices podcast. I'm Dr. Resa E. Lewis, emergency medicine and lifestyle medicine physician, educator, and your host. My guest today is Dr. Columbus Batiste, interventional cardiologist, lifestyle medicine physician, regional chief of cardiology for Southern California Permanente Medical Group, founder of The Healthy Heart Nation, and author of Selfish, a cardiologist's guide to healing a broken heart. Columbus places a pin in two aha moments, two preventable deaths due to chronic disease, unrelated to his clinical practice, rather related to two family members, his father and his father-in-law, diabetes, and kidney failure due to high blood pressure. I first met Dr. Batiste at a lifestyle medicine conference. I valued his visible voice as a cardiologist who decided that prescriptions and procedures alone are not enough. Dr. Batiste, welcome to the Visible Voices podcast.
Thank you for having me. It's good to see you.
Good to see you too. So, Columbus, you trained at Loma Linda, which sits inside one of the world's blue zones. Blue zones, Seventh-day Adventists, the Netflix documentary.
Well, I think blue zones are essentially what all of us aspire to, which is the concept of not only living a fulfilling life, living a lengthy life as well is one of the key goals in terms of the blue zone. So what Dan Buettner in the National Geographic, they outlined were areas or pockets around the world where they were able to identify some of the most longest living individuals in their 80s, 90s, and even to their hundreds who were active. It's the antithesis of what we see inside of America. It's not individuals inside of a nursing home, those who are devoid of family members or without purpose. These are individuals who are actively engaged in their community. They're participatory in terms of being a part of a social connection. And he found overlapping areas in which they live, work, play, and pray, which is so vitally important. And he was able to identify consistencies, a similar theme. And so Loma Linda is one of the only sites inside of North America that has the blue zone that's been identified.
And that ties in, I mentioned Seventh-day Adventists and the community around Loma Linda. There are specific dietary lifestyle practices that get them into the blue zone.
So the Seventh-day Adventists, they believe in nutrition first as a way in which we can maintain our human bodies and restore health, right? And so it's centered on a plant-based diet, which means heavy in legumes, nuts and seeds, and fruits and vegetables are the core components of a dietary pattern. That, along with activity, with movement, along with sunlight, along with connection, they obviously prioritize their relationship with God. And so that's a essential component with the Adventist faith, along with the aspects of coming together in terms of a congregation and the intimacy of relationships.
You and I share lifestyle medicine, and there are pillars. Audience members may not be familiar. One is food is medicine. You mentioned that. Another is movement. You mentioned that. Another is being in community. You mentioned that. There's intentional sleep, avoiding stress, and avoiding harmful substances. And this also is a Venn diagram with Seventh-day Adventist beliefs about avoiding alcohol.
One of the things that research is telling us, and this has been something that as a cardiologist, I think we have contributed to the misinformation because we've highlighted the importance of, or we've said, hey, drink a little red wine. It's not so bad for you. But more and more studies are really pointing us to the direction that the best course of action is zero alcohol. And I know a lot of viewers may not like to hear that. One of the things that's so funny is that what we do in life is that we will go ahead and search and ask people their advice until we find the group of individuals who validate our belief system anyway, right? So some of your viewers may not like what I'm saying right now, but what some of the studies tell us, when we look holistically at health, not just cardiovascular health, we see an increased risk of cancers. We see an increased risk of adverse events that occur. And when we hone in, we always try to, here's one of the key things I've observed in my practice. When we speak to moderation, temperance, do you ever recognize that those words are always assigned and attributed to things we probably shouldn't be doing at all? We never speak about being moderate in our water intake. Be moderate with your fruits and vegetables. I never hear that once. I hear be moderate in the cake. I'm very moderate in my alcohol consumption, but we never say that about anything that's truly health promoting. It's interesting.
It's almost like you're an audience plant. Double entendre there, but you are an audience plant. You're the guest. So you have talked about how moderation kills, and it's such a poignant story. And I really resonate it because I see the same thing. People are like, well, everything in moderation, including ultra processed foods, including alcohol, including sweets. But moderation kills. Can you share that very personal story?
That's a substantial one. So I'll tell you first where that came from. I didn't originate with the idea of moderation kills. That is a chapter in Caldwell Esselstyn's book, Moderation Kills. And it came and became the pages just uncovered and they jumped out and spoke to me. And so he spoke to me after the tragedy of my dad's passing. And so my dad was a person who was a double entendre. He spoke about health and wellness. He actually had a health food store back in the
Mhm.
70s.
I love that.
And so they had to stop it because I was a pleasant surprise. I wasn't my brother is 16 years older than I am. So pleasant surprise. And so it was very lean in terms of resource and staffing. My mom played a substantial role. But so they had to close the store, but they made juices. They had she made soy and gluten from scratch and they sold this along with vitamins and did all those things. They said my sister came out somewhat orange because my dad was insisting on carrots and apples and juicing. And then my mom would take the fiber and she would make muffins and various things like that to repurpose it. So they were very much so into that. He sold herbs and did all those things. But at the same point, he loved his sweets. He didn't drink alcohol. Anyone on the outside would say my dad was healthy. He had all this, but he loved his sweets, loved his diet sodas, and he struggled with his diabetes from in my inception. And so what's so interesting about this is that as I matured and as I went through med school and as entered into practice, I recognized that as I'm prescribing medications, I interacted with patients who were very intolerant to very small doses of medications. I had some patients where they needed max doses before they ever had any side effects. What resonated with me after my dad passed away is we never know what the exact amount of these deleterious, harmful substances will play in our body. We don't know whether or not it's a small amount or if it's a large amount that will cause disease, inflame the fires. And so the problem is that when we talk about being moderate and having an amount, we don't know what's happening beneath the surface because many people are not inspecting what they expect. They're not checking their labs or their markers of inflammation, or they're saying that, and we're uncovering this more and more within the field of even cardiology. So I'll have patients who will come to me and they'll tell me, but doc, my blood pressure's good. My cholesterol's good. I'm not diabetic. I can have whatever. I look slim and thin and fit. I can have whatever I want. Well, what we've identified in the field of cardiology is that there are a group of individuals, we call them SMRF-less, and we call these standard modifiable risk factors. These are SMRFs, high blood pressure, smoking, diabetes. And so when you're SMRF-less, that means you don't have any of those. But what studies have demonstrated, individuals who are SMRF-less, they still have heart attacks. And when they have heart attacks, they have a higher risk of death. They have a higher risk of adverse events that occur during this period of time. And what we've uncovered is inflammation. What we've uncovered are these remnant particles that are not readily identified or checked on a regular basis, marked by C-reactive protein. And so individuals who think you're safe, but you're not, because we're flaming the fires of disease, even with the moderate amounts.
So moderation kills. And to your point, many of these non-communicable chronic diseases are silent until they're not, until it's a heart
Yes.
attack, until it's a stroke, I can't really feel my feet very well because I now have diabetic
Yes.
neuropathy. I too have diabetes in both sides of my family. And people struggle with understanding, okay, now that I have it, what do I do? Do I modify anything? How do you counsel? What are your thoughts, the science on diet sodas versus drinking full on sugar soda?
Yeah, I think everything ends up being what it's in relationship to, right? So if I'm looking at alcohol compared to sodas, sodas versus diet sodas, sodas versus no sodas whatsoever. Clearly, No soda whatsoever is the best course of action. Now, if you're like me, who was a kid who grew up drinking those dark colored sodas that had caffeine inside of it when I was a teenager, I like the sparkling taste. So what do? I have sparkling water that I add lemon and lime and cucumber to with a bit of flavor there. And that's my go-to. Maybe if I'm living a little bit on the edge, I might have kombucha every blue moon. But what my goal is to stay away from substances that have limited value. So we know the impact of sugar. We know that consumption of a can of sugary drink raises your inflammatory markers immediately. It raises your C-reactive protein, as I just spoke about with that. That's impactful. We know the harms that have been identified by increased platelet or stickiness or clotting factors inside the vessels with some of the sugar substitutes, aspartame, and some of the other ones that are there, the cancer-causing effects. So when we're comparing two different things and we're trying to once again find someone who's going to validate our habits. So it really digs to what do you want? What do you really want? Now, if what you want is health, the next question is, what are you willing to do to get what you want? But the third question is, what won't you do to get what you want? When you really look at it from that lens, that vantage point, that perspective, if health, I want health. And now you speak to anyone, you've dealt with individuals in the emergency room who are on the precipice of death. I have too as well inside the cath lab and inside the ICU. And I can guarantee you that all of those individuals would say, I would do anything for my health. I would pay any amount of money. I would do whatever it takes to get it done. Well, if that means that's that priority to you at that point in life, why isn't it that priority right now?
Bingo.
And if it is, what's more important? My family, my passion, my purpose, or this can of soda that I'm willing to go ahead and expose myself to a risk of diet soda and say that it's better than regular sugar soda.
It's obvious to audience, you, cardiology, cath lab, heart attacks, me, emergency medicine, we end up having an overlap in the patients for whom we care. And you've been an advocate, as we've already discussed, about actions and behaviors people can take. We talked a little bit about sugar sweetened beverages. You have episodes where you've talked about foods that can be called like blood pressure foods that if you eat them, they can help. And give us 3.
I'll tell you, one of the ones that I love, and it's not exactly a food, but I'm going to go ahead and take a little liberty, artistic liberty, and I'm going to call out hibiscus tea, a flower. I love hibiscus. This is probably my favorite. I'm not saying it's the most powerful, but it's one of my favorites. And here's why. Hibiscus is like the original OG multi-drug pill that you can take. It has a little bit of a calcium channel blockade effect. It has a little bit of an ACE inhibitor, angiotensin converting enzyme, which stops angiotensin 2, which basically causes your vessels to tighten up, increasing the resistance, which drives your blood pressure up. It has a little bit of an effect of what's called a diuretic or a water pill, or causes your kidneys to release some of the volume. So you decrease the volume that's there. Now that lowers the blood pressure. I mentioned that calcium channel blockade, which now that causes the smooth muscle cells. So your arteries I'll tell you, your body is so beautifully and wonderfully made that you have this idea that your vessels are not exactly like pipes, even though that's the most common description that I use and everyone else uses. But there's actually 3 layers. The inner layer is like this singular layer of cells called the intima and is lined by what's called the endothelium, which is like a Teflon pan, which none of your viewers are using, by the way. I'm certain of that. But this is resistant to everything. Then it has a middle layer that's a muscular layer. And then it has an outer layer that's like a fat tissue. And so when you have calcium influx, that can cause tightening of that muscular layer. So a calcium channel blocker, that allows relaxation of that muscular layer, what we call smooth muscle, that can now lower the blood pressure. So you have, and then on top of it, here's what hibiscus also does. It elicits what's called nitric oxide. Now, nitric oxide is like the super signal that the inner lining of the cells, it emanates that says, no, we're going to be resistant to invaders or invading and causing disruption to the lining, but it also leads to the vessel relaxing. So now you have this multiplicity of effects from this single cup of tea that you brew, that you put in the calyces of the flower pots and you let it sit and you simmer, not for 1 minute because you're in a rush, not just for 2 minutes, but from 10 to 20 minutes, and you get the therapeutic effect. So much so that researchers have validated this against actual medications. I'm not saying they'll replace the medications, but it's powerful.
Yeah.
So that's one of my favorites. Any cardiologist who is a wise cardiologist is going to tell you about dark green leafy vegetables. Now, I don't mean your burger that you're taking off the iceberg letter that has no color to it. The more color, the better off for you. So when you're getting into the arugula, it's one of the ones I love is arugula. The dark green, the kale, all the collards, all of these, but the arugula is rich in dietary nitrates that the body will then convert over and then allow, once again, release of the nitric oxide that dilates the vessels that can lower your blood pressure too as well. That fiber component is huge. But here's the thing, most people don't realize I have an issue with this. I have to admit, I'm insane when it comes to brushing my teeth and mouthwash. That's what I do on a regular basis. But if you do that when you're eating the green leafy vegetables, you may not get the benefit because it relies upon your mouth bacteria to process this. So you want to make sure, I'm not saying walk around with stinky breath, but what I'm saying though is don't use the mouthwash when you're eating and consuming the foods. Now, here's my third one I'm going, I'll tell you, I'm going to give you three options. I'll choose one at the end. I want to say flaxseed because flaxseed it gives you the fiber, it lowers the inflammation, it lowers the cholesterol, and it helps the blood pressure. I was thinking about that one. Then I thought about garlic. Garlic is so powerful. Garlic is amazing. It decreased from the allium family. It decreases the stickiness in the vessels. It lowers the blood pressure. But aged garlic has been demonstrated to actually decrease and recede the calcification of your coronary vasculature. So it's hard. And then I love blueberries. With anthocyanins so I think I'm gonna go with blueberries just from a dessert perspective standpoint, because it's good for the mind and for learning. We know that it's good for cancer relief. We know that it's good for blood pressure. And that as you're having all these anthocyanins, which essentially are antioxidants rich, you're empowering your body. And I can't even believe I left out beets, which is probably the most potent one that's there. So it's hard to make you choose when there's so much in front of you that's powerful. That's the beauty of lifestyle medicine. You have at your disposal an armament of medicinal foods that can offset disease burden. That's
Yeah.
incredible to me.
And as I've done a deeper dive into the scientific literature, I just can't believe it. And I just think, there's this compulsion to want to educate and share because it doesn't have to be complicated. It really can be simple. I want to circle back to something we talked about the silence of some of these chronic diseases. I wrote a piece about we should be thinking about our behaviors and our actions and what we're putting in our mouth and what we're drinking in our 20s and 30s, not waiting till it shows up in our 50s, 60s, 70s. So you're probably seeing patients a little elder, little less young, but it's the young people we really need to get these messages to.
So 2 components to it. One of the things when I look at the younger population, teens, 20s, 30s, one of the things that's so important that I try and describe to them, and I'll say this to patients as well. During the pandemic, one of the things that, irrespective of quote unquote the belief about the virus and so forth, we knew that if you lock someone in a closet with another person who has a viral load, they're coughing, the longer you're in that closet, you're going to develop the disease. You're obviously being exposed at a higher concentration level. The longer you're there, the more likelihood of an adverse disease burden. Same thing happens with chronic disease. The longer your lipid profile is abnormal, the longer your inflammation is abnormal, the normal your body is under, your heart's under stress from hypertension, that you're exposed from, forget about prediabetes, because I'm going to say that's like saying I'm a little bit pregnant, right?
Mhm.
That you have a metabolic syndrome going on in your body. That means the more likely disease is occurring exponentially. And so the question is, how do we get folks to understand about investing in their health future? Like I'm investing in my financial future. Because if you start in your teens and your 20s, you get a better return on investment over the long haul. And yes, you may ebb and flow, but if you start, the earlier you start, the more the payoff is. And so one of the things I think is phenomenal, at least within the field of cardiology that was developed, is something called the heart age. So instead of me throwing out to you that, well, you have a risk of 10% over the next ensuing 10 years of a heart attack, or you have a 7.5, okay, I'm gonna look on the flip side. I have a 93% chance I'm gonna be fine, or a 90% I'm good. I'm not going with X, Y, and Z. But how about if I tell you that you're 25, but your heart is the age of a 45-year-old? That weighs heavily. You all of a sudden, you're seeing what I'm seeing when I'm looking at the arteries, that I am not expecting a visual appearance of the way that it looks right now, and how it's important for us to make steps to mitigate the future. There was a great movie by an actor, Tom Cruise, right? So there was a movie called The Minority Report. This is a sci-fi movie, but the only thing that stuck home with me is that his job was to stop a crime before it ever happened. And so he would go back in time, and before the criminal even committed the crime, he would arrest them for a future crime. So I tell patients all the time when I'm seeing them that I've been sent from the future to help them stop a crime before it happens. And we need to make a decision right now, because otherwise I see what's going to happen in the future. It hasn't occurred yet, and we still have time. And that's where people have to understand that we have it, and you have to remind yourself daily, because it's hard at times, because life is lifing, as they like to say in this day and age, and things are there around us.
100%. I just got a flash of like being the super friends back at the Hall of Justice.
That's right. I love that. I love it. I love it. Yes.
I want to talk a little bit about optimization. There's this big longevity medicine culture that a lot of people hear about, a lot of news feeds about it. Two things I'd love your input on regarding movement, efficiency, exercise is number one, creatine, and number two, peptides.
Well, first and foremost, I think we have to get back to the basics of food, real food, whole food that's recognizable upon the eons of time. And as I briefly outlined, as it relates to even some of the mechanisms of action that we're still in the process of uncovering, there's so much rich mechanisms in phytonutrients that we have not even uncovered. But we're trying to move into the Jetson era. And for those who don't remember Jetsons, they loved eating like just a pill or taking something really quick. And that was their way to kind of consolidate things. And we're trying to be a reductionist down to the microcosm of what is impactful. And we throw out the baby with the bathwater, and understanding that there is so much value there. So with that being said, yes, as studies have looked at aspects of creatine, we've seen that there is some benefit with creatine, with cardiovascular health, and with various other aspects with women's health. And we've seen this across the board. And so I'm certainly not going to negate some of the research that's pouring in regarding these substances that are there, the creatine and the peptides. I've done a few series on creatine and a few on peptides. But here's the thing. I come back to the same point every time. I realize we all have to trust somebody in something, but I know a head of broccoli when I see it. I know generally where it comes from. I know what beans are. When I'm buying a package that has powder in it, I do not know where that powder is coming from. And the vast majorities of the powders and pills are not regulated. Even those that are, and whether it's NSF or some of the other validating companies for supplements and powders and so forth, there still are a higher level of limitation that's there. And we have to be very cautious about what we're putting into our body under the presumption that it's good. Right. And so that's what I would caution folks out there is try starting, focus, maximize on what you know. If I'm still not sure, I want to take it to another level. Okay, fine. I'm going to an actual farm and I'm getting my broccoli and my berries. And that way I see where it's growing and I see that they picked it. I'm getting my strawberries and so forth. I can go in and show me your pesticides. I recently just went up to a farm and looked over all of the layout that they have. I order my collard greens and my mustards and my arugula from that farm, and they have it sent to me. And I went to visit, and it's phenomenal in terms of what I saw in that moment. So that's what I just want full circle, and not to negate any of that, but I want to draw everyone's attention back to what is important and valuable.
I make a joke about it's about whole foods. And I'm like, no, I'm not talking about where to shop because there's always pushback about affordability and access. How do you speak with patients that do give that pushback? Doc, I can't afford organic. Doc, I can't shop at that place. Or literally where they live, they cannot access whole real foods.
I will tell you, I am guilty of that as well. Right. So when I first started inside of this vein, and after my dad passed, I started doing the research and read books. And this is before the era of like nutrition facts and open evidence, and where everything was readily accessible. I had to really kind of pour in and start to look at bibliographies and references and go through things. But nevertheless, when I started putting that together and decided I was going to start making a footprint in my own voice inside of communities and in the hospital, I'll never forget, I was like coming in and I was preaching like, oh, you gotta be whole food. And at that point I said, no oil, no salt, no sugar. And I was saying all this to a patient, and he looked at me and he said, Doc, I live in almost a 400 square foot apartment. It's infested with cockroaches. I don't have a refrigerator space for that or cooking space. A hot plate's all I had. We were in clinic and he was honest with me, and he stopped me in my tracks. That was the best thing that ever happened to me, because I reset it in that moment. I said, okay, let's work where you're at. We're going to buy frozen vegetables. We're going to buy canned beans. We're going to look at things that can remain, have a shelf space. We're going to make convenience work for us. And so around that time, I had started a cooking class I was doing in conjunction with the lectures I was giving. And I called the cooking class the CATH lab. Now, the CATH lab is where, for folks out there who don't know, that's where I take patients who are in the throes of a heart attack, the cardiac catheterization laboratory. We call it the CATH lab. And so I said, we're going to start the CATH lab. I remember first the dietitian I hired was like, what? I said, yeah, cooking alternative to health. And I said, the only problem with that is the alternative. It should not be alternative. It is the solution to health. And so we started the CATH lab. And what we did was we started kind of cooking and doing things, and we would engage with patients through sight and smell. And I would lecture on all the valuable components of these fruits and vegetables that they recognize and how it played a role in the medicinal health. Phenomenal. We did that for 4 years. It was one of the best times of my life until the pandemic hit. And I will tell you, I told my dietitian, we're going to do a no cooking class. And she looked at me and she was like, what are you talking about? Nobody's going to want to do that. I said, everyone's going to want to do this. It was one of
Yeah.
our highest rated classes that people poured in for, because I said, everyone's busy. We're going to learn how to create the food quickly in a microwave or a stove, whatever your preference. Simple, replicating a bowl method. And we're going to do it because here's the thing. Whether you're shopping at a large manufactured store that's on every place, I can find it at the 99-cent store. I can find frozen fruits and vegetables there. We're going to learn how to make soups, salads, and smoothies.
Love it.
Chili salads and smoothies, and make it affordable and fun for the family, in a bowl method that allows easy adoption. The less everyone has access, it's knowledge of understanding, how do I go about it? And it seems so simple, and it is simple, but sometimes it's like those crossword puzzles or those little small puzzles, and you're like, oh, I was looking at that the whole time. Why didn't I see that? When I show people the simplicity of pouring it and making your own bowl, whatever cultural style, they're like, that was easy.
Yeah.
And I know they're thinking, well, I could figure this out on my own. And you're absolutely right. You absolutely could have.
Yeah. So,
Look who got my book. Who is
so
that? Who is that AI figure on there?
you wrote a book and it's got a tagline, but the main title is Selfish. And it's a very provocative title.
It really is a conglomeration of all the things I would discuss with my patients that I learned outside of cardiology. I didn't go into cardiology thinking I was going to talk about psychiatry or psychology. I didn't think I was going to talk about nutrition. I didn't think I was going to talk about gut health, but somehow I found myself talking about all those things. So the first S in selfish stands for spirituality. And usually everyone says, okay, well, I'm not religious, doc. And I said, it's not necessarily about religion. It's about a mindset. And we talk about meditation or prayer if you are religious. We're talking about the aspect of breath work, understanding that the root word of spirit or spirituality is spiritus, which is breath from the Latin root. And so we understand the power of breath. And they say, well, doc, I know how to breathe. And I said, do you? What happens when you're stressed? Are you taking a deep breath in and out? Are you exhaling? And we understand the restriction that's there, but the impact of what that does for our stress hormones, what it does for our perception of stress. But here's the key, what it does for our endothelium and our vasculature by just adopting a powerful breath work, the powerful nature of meditation. And here's the key, meditation is really about being calm. It's about coming away from the noise of the world and just centering yourself and knowing that when you do that, you can turn down the activity of that small pea-sized amygdala, which houses our fear and drives the stress hormone cascade, that we can do that simply by adopting this one tool. It's something I do whether I'm in the cath lab or I'm in meetings. That's the first S. The E stands for exercise. Now, before I get into the obvious of movement, I believe there's a power of belief, exercising our faith, our belief in the power that, yes, you can overcome this. Study after study tells us the power of our mind, the power of a belief has been done beautifully in Stanford, and research that's done there. We know placebo and nocebo. We get it. And then obviously keeping the body in motion is so powerful for cardiovascular health. It's powerful for our mental health. It's powerful, especially when we do the exercise outdoors, whether you call it forest bathing or exposure to measured amounts of sunlight, that now you're going to see this interconnectivity between all the pillars of selfish, because when I'm in the sun, now I can release the nitric oxide stores underneath my skin that then begins to dilate my vessels and lowers my blood pressure by having measured sunlight. That's powerful. The L stands for love. And anyone who's loved anybody or anything, I just got off a meeting before we connected, and there was someone who I was on the phone with told me that his 13-year-old companion dog is passing away, and was talking about the stress from that. He loves his dog. He loves his companion. And we love, whether it's a companion animal or whether or not it's a significant other or it's a family member, we know that love includes forgiveness, gratitude, giving of ourselves, altruism. These are actions. Love is a verb. And studies have demonstrated that when we love, yes, we release oxytocin from human touch, which allows the tendon befriend and the restoration of our vasculature. Yes, that we know that when we engage in forgiveness, it's not for the other person, it's for us. It helps you're evicting people from having free rent in your head as you're perseverating over them. That when you forgive, studies have shown that you can increase the blood flow to the heart muscle. That's powerful, right? So the F, the centerpiece pillar of selfish, is food, real food, whole food, not food insecurity, but food that enriches you, food that's part of your culture. Because I'll tell you, every single culture has health promoting foods built into it. From potatoes to spices to whole grains to beans, there is an enrichment of nutritional medicinal value inside the foods that we eat. The I, it stands for intimacy of relationships, community, the power of coming together as a community, not isolating. I love research on the trees, that how some of the taller trees will help provide supplement and nutrition to the shorter trees that can't reach out to grab the sunlight through a network, the world wood web, they call it. And they're delivering nutrients back and forth. Why can't we be like that as a society? That our connections, our relationships, that everyone deserves to be loved, to be respected because they are. And so when we begin that and we understand that having someone that we can lower the guard, and guess what? They're saying, you know what, Columbus, you're corny, but I love you. My wife looks at me and she's like, you're a little bit of a nerd, but I love you. I can be a nerd. I can be corny. I can laugh at silly jokes, and I will not be judged where someone is going to put me out. The second S stands for sleep. It's for rest. It's for vacation. It's from time away. And vacation doesn't mean you have to go to Tahiti, although that's not a bad place if someone wants to send me. Vacation could mean I'm taking time away from the daily toils of life. That's one of the key components that the Adventist church, the Jewish faith, that religion they have in terms of stepping away from the toils of daily practice to come together with and engage in the intimacy of relationships, to engage in the exercise of nature and being outdoors and spirituality. And you see this interconnectedness, that when we rest, we restore and we empower our brain, that we lower our blood pressure, that our inflammation decreases. And then the H stands for humor, for joy of life, for smiling, for laughing. That when you laugh, when you smile, your functional capacity increases, that your blood pressure decreases, that we know that your mindset improves. And here's the thing, whether it's a fake smile, someone I crack a joke and you're like, ha 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 ha, ha, you still get the benefits. And so here's a powerful example I want to give you. I oversee a program called cardiac rehabilitation. This is for patients who have succumbed to heart attacks and heart failure, et cetera. And we're teaching them the importance of lifestyle, nutrition, exercise, the role medications plays in that, the role in terms of the psychology and mental health. And so we know it is one of the most powerful tools available in cardiology that's underutilized. So what they did is they took two groups of individuals. They both put them both through cardiac rehab, but one group, they said, all we want you to do is to watch something that will make you laugh for 30 minutes a day. We don't care what it is. It can be a comedian's comic. It can be some sort of sitcom, whatever you want, just for 30 minutes. What they found are that in the individuals who watched and laughed, lower incidence or lower rates of angina or chest discomfort, lower rates of repeated hospitalization, improved outcomes. There is power in our mindset. So what did I do as I was doing research for the book and things I would tell patients when I'm reading my echoes as I'm rounding in the hospital? I'm playing my favorite, don't judge me. I'm not even going to call out the name of the comedy show, but I'm playing the comedy show in the background and just laughing as I'm reading my studies and dealing with sick patients. That's very stressful. I take time aside to make sure I laugh. And my wife always says, man, if people saw how silly you are, they would be shocked because it is something that restores my soul, is what I found. So I always tell people, you get selfish. It's not for things, but to live a life of purpose. And that's really where our goal is. And that's why I love what you're doing. I love how you've adopted the message and you've transformed to kind of say, you know what? I'm going to deliver information in a format that people can receive it and hopefully make a change. That's powerful. That's powerful for you to take that step out there. It's not easy for physicians who are very regimented. We do things a certain way, and to navigate away from that to any degree, there is a level that people don't understand of skepticism from colleagues and from others.
Columbus, when did you realize you had a voice, and when did you start using your voice?
It took me a while. I said, what's the point of me saying anything? You have giants in the field. What am I adding to it? I haven't actually done the research with some of these areas here. I've done little small bits. And finally, I realized it was someone, it was a friend we had over to the house, and we were talking about someone. And we said, oh, how did they do? How was their sermon? How was they speaking? He said, well, I never grade people on how they speak or whatever else because everyone receives it differently. And some people connect to different people. And I started thinking about that. I said, there are hundreds of superhero movies. It's always the good guy versus bad guys, but there is certain framing, there are certain contextual, there are certain ways in which a story is delivered that resonates with some versus others. And as I began to realize that, I became more and more comfortable that I am uniquely myself, that this taste is not for everyone. It may be for some. And I have to be okay with that. But my goal is that if I can touch one person, if my message, my style, the way I'm delivering information can resonate with one person, I've done my job. That's really what it's about. So it took me a while, but I finally did. And when I did, and I started getting a little bit of feedback, I believe things were laid out the way that it was supposed to. I spoke to that very first patient, and I was hesitant, being an African-American interventional cardiologist, that I did not want to be seen as a weirdo talking about nutrition. And I did. And the first three patients, they embraced it. I had no elevator pitch. I had none of the analogies. I was like, read this book. No, you can do it. That was it.
Don't
it was
drink soda.
Yeah, I don't even know what I said. It was nothing powerful, but they did it and they made transformations that even my colleague who hired me was like, maybe there's something to what you're saying. And that inspired me to continue on. And then I was fortunate enough to get encouragement from some of the giants. Cabo Esselstyn, Hans Steele, who passed, and because others who were in my practice knew of the work and heard that I was doing some of this. And when they called, I felt like, I can't believe they're calling me. You're lying. This can't be such and such. And all they said to me, keep doing the work. We're here for you. Anything you need, let us know. And they were so altruistic. They expressed love in terms of giving of themselves to me and welcoming me into a community that taught me some of the pillars of selfish right there. And that from there, I said, that's my goal. It's just to help people any way I can and to pay penance for what I didn't know.
For listeners that want to follow you, your journey,
sign up on drbatiste.com, not for any type of monetary. I don't have any subscriptions, but send out a blog daily, just launch a YouTube channel. that I'm trying to deliver content on there in a way. And so would love to kind of see and connect with you on there and hear about aspects of what you want to hear as I geek out a little bit to some degree over some of the science behind some of the fruits and vegetables and the impact.
Everybody's welcome on the Visible Voices podcast. Thank you so much, Dr. Columbus Batiste, for joining me today.
Oh, it's been a pleasure. It's been a pleasure. It's good to connect.
The Visible Voices podcast amplifies voices in the healthcare, equity, and innovation spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by hosts and guests are their own and do not reflect those of their employers or institutions. Guest appearances do not imply endorsement of any product, service, or organization. Information shared here is intended for general informational purposes only, reflects the time of recording, and should never substitute for clinical judgment or individualized medical advice. No physician-patient relationship is created by listening to or watching this podcast. Together, we're making healthcare more equitable, one visible voice at a time.